Hello students, today we are going to learn about the system RAAS. The full form of RAAS is Renin, Angiotensin, Aldesterone system. The system RAAS is a hormonal system for the regulation of blood pressure in our body. Another system which is present for the regulation of the blood pressure in our body is baroreflex, which is a short-term action, while this RAAS system is for long-term action. As the full form of RAAS, Renin Angiotensin Aldosterone system, it is having the three major components: renin, angiotensin, and aldosterone. Now this system works with the association of various organs. So major organs which are associated with this system are blood vessels, kidney, liver, lungs, adrenal gland, and pituitary gland. So let's see how these organs work together and this system comes in action. Now, renin-angiotensin-aldosterone system activates when the BP drops. When the BP drops, firstly, it stimulates the sympathetic nervous system. Sympathetic nervous system send impulses to the juxtaglomerular cells which are present at the glomerulus in the nephron of the kidney, which promotes the release of renin, the first component of this system. Now this renin stimulates the release of angiotensinogen in the liver. This angiotensinogen converts into angiotensin 1, which is the second component of this system. But here the word angiotensin is there. So angiotensin 1, with the help of the enzyme angiotensin converting enzyme which is present in the lungs, converts into angiotensin 2. The name angiotensin converting enzyme itself suggested it converts the angiotensin. So from what? Angiotensin 1 to angiotensin 2, which is now giving the action on the various organs. Angiotensin 2 is having the action on blood vessels, on adrenal gland, and on pituitary gland in CNS. On blood vessel, it gives the direct action by causing vasoconstriction. On blood vessel, it gives direct action by causing vasoconstriction. Now the adrenal gland. Angiotensin 2 acts on adrenal gland by release of aldosterone. Aldosterone is released from the adrenal cortex. This aldosterone acts on kidney by promoting the sodium and water retention. The third action of angiotensin 2 is on pituitary gland by releasing the ADH. The full form of ADH is antidiuretic hormone. As per its name, it causes antidiuretion, and by this way it promotes the water retention. So now, as of the result of combined effect of sodium and water retention and vasoconstriction, there is seen the BP rises. What it caused? The combined effect of these both causes the BP to rise and returns to the normal. So let's see a short revision of this renin-angiotensin-aldosterone system. As the BP drops, it stimulates sympathetic nervous system by activating juxtaglomerular cells in kidney, which promotes the release of renin. Renin promotes the release of angiotensinogen, which is converted into angiotensin 1. Angiotensin 1, with the help of the enzyme ACE or the angiotensin converting enzyme, converts into angiotensin 2. Angiotensin 2 is having the effect on blood vessel causing the vasoconstriction, on adrenal gland causing the release of aldosterone, the third component of the system, by promoting its sodium and water retention. The third action of the angiotensin 2 is on CNS, on pituitary gland by promoting the release of ADH, and by this way this ADH causes the water retention in kidney. So this is what the RAAS is. Thank you.